I'm getting a lot of questions from you on my social feeds about vaccines, about testing. Let's get some answers from Dr. David Winter from Baylor Scott & White Health. Good morning to you. Good to see you.
Good morning, Sonia. Always good to be with you.
Thank you. So let's first talk about Johnson & Johnson. Promising, yes?
You know, it's a good vaccine with two potential bonuses. It only takes one shot, and you can store it in a regular refrigerator, so not those super freezers that the other have. Now, it's hard to compare it to Pfizer and Moderna vaccines. The phase 3 trials and all those were done with different populations. But here's the bottom line. No one who got the J&J vaccine, no one 4 weeks out got severely sick, and no one required hospitalization. So it's a good vaccine, Sonia.
Okay, I'm hearing from some people, do you need only one shot if you've had COVID before? Have you heard that? What do you say to that?
Yeah, there's no good evidence for that. So we're still recommending 2 shots of Pfizer or 2 shots of Moderna if you get those 2 vaccines.
Okay, also another big question here. Can you cross-pollinate if necessary? Meaning if you got the Moderna shot first, can you go ahead and get Pfizer? Now, this is something we've been saying, no, you can't do that. Has that changed?
Well, the active ingredients in both is exactly the same. It's just the capsule which is different. So theoretically, you could take the other one, but still the evidence is not out there. We haven't studied that. So if you can get the other one at all possible, you should do that. If not, perhaps it can be exchanged. There's no theoretical scientific reason that you could not do that.
Yeah, and I guess that makes sense. It's the way that it's been studied that, you know, that's how the scientists want you to do it. Okay, from Amy, is it true that taste and smell loss is linked to zinc deficiency?
No. The loss of taste and smell is because the coronavirus damages the nerves in your nose. Zinc has nothing to do with that.
Okay, John is asking, can those who do get the second vaccine dose be asymptomatic carriers? So even if you get both doses, can you still be an asymptomatic carrier?
That's a very important question. We know the vaccine prevents severe illness, prevents hospitalization. We don't know if it prevents transmission. Studies are going on right now. But if you've had 2 vaccines, you should still wear your mask, distance, and disinfect your hands.
Bo is asking, how long do antibodies last? We've talked about this one.
That's an important question. The predictions are 3 months. Some people say 12 months or even longer. We don't know. Time will tell.
Michelle wants to know, I'm 1 month out battling COVID, and I still have severe fatigue. So she's asking, how long will this last and why?
Boy, those are what we call the long haulers. We're seeing a small minority of folks that do that, and we don't know exactly what to do with those folks. We have some rehab programs that have been helpful, so she might want to talk to her physician about a rehab program for the long haulers. No specific treatment right now is known to work.
I've seen Facebook support groups for long haulers as well. Robert wants to know, how well do the COVID antibodies or the vaccines protect from these different strains we've been hearing about?
So far, they do protect against the different strains, but as Dr. Fauci just said, it's imperative we get rid of this virus because future variants, future mutations may not be quite as friendly with the vaccine. We need to get more people vaccinated.
Kathleen's question, could the vaccine cause blood clots like the virus does?
No, absolutely not.
Okay, no evidence of that. Diego is asking, what are your thoughts on the AstraZeneca vaccine? We haven't talked much about this one.
Yeah, it seemed like it's a good vaccine. It's similar to the J&J vaccine, although it's different. It requires 2 doses. Now, a German scientific advisory committee said they weren't going to approve it for folks over age 65, not because of the problem, because it hadn't been studied there. So more results need to be studied to see how well we're going to use this vaccine, but it should be a welcome addition once they get it perfected and studied well.
Okay, Robert is asking a very common question. How long should you wait to get the vaccine after you've recovered from COVID?
We know that if you've had COVID and recently got over it and get a vaccine, you're more likely to have a big reaction in your arm, maybe chills, fever, fatigue. So waiting longer may work. Some folks say go ahead and get it. Some doctors are saying you ought to wait 2 or 3 months. So the total answer to that still is not yet known.
Olivia's asking, will vaccine be available to my Down syndrome son soon?
You know, we hope so. That's in the 1B category, though there's still restrictions on folks less than age 16 with one vaccine less than age 18. So more studies to come out, but we hope those folks can also get it soon.
Some of these are very specific. Dr. Winter, Jill is asking, any data on Bell's palsy or Guillain-Barré survivors who have had COVID or received vaccines?
No, that's been studied pretty well, and we see Bell's palsy and Guillain-Barré in folks who've had the vaccine, had the illness, and folks that didn't. So no increase in those types of diseases.
Okay, last one. Kim is asking, can COVID cause swollen lymph nodes?
We haven't seen much of that with the COVID disease, but we have seen it with the vaccines. So it's not uncommon if you get a vaccine in your left arm for the lymph nodes in your left arm to swell up. That goes away in time, not a big deal, but can be confusing for some women who worry about breast and breast cancer. It does not cause that, but it can cause temporary swelling of those lymph nodes.
Okay, Dr. Winter, thank you so much for answering those rapid fire questions. That was very helpful. We appreciate it.
Lots of questions, lots of fun. Thank you, Sonia.